first and foremost, thank you for coming. My name is Shelley Esden, and I'm apologizing in advance. I've lost my voice throughout the conference for some reason. This session is about video surveillance, and I want to kick things off by talking about how tech, as we know, has come a long way. But what's even more exciting than tech and the evolution of technology is the fact that senior living is finally catching up. For those of you that have been working in senior living for many years, you may remember it was only 10 years ago when we were saying, you know what, we don't need Wi-Fi in our buildings, or maybe it was a little over 10 years for Wi-Fi, but certainly we don't need to worry about residents using iPhones. Our residents will never use iPhones. So now we're seeing that not only do we have residents using iPhones, but they're actually using video, they're using all sorts of technology. And as we evaluate how to optimize this technology, it's important that we really learn as much as we can to embrace it, to ensure that we're getting the outcomes and that we're utilizing this not only for the benefit of our residents to ensure their safety and well-being, but also their families. Because as we have Gen X and boomers looking to ways to take advantage of video, we also have to balance that with resident rights. And then also for optimization, how do we ensure that our staff and our caregivers are utilizing this? So this panel is a little unusual. We actually have 3 amazing leaders from 3 different technology firms. And I want to kick things off by asking them to introduce themselves, a little bit about their technology and the companies they represent. And first and foremost, I'm going to kick things off with Natalie.
All right. Well, good morning, everyone. As Shelley said, thank you so much for being here. My name is Natalie Barman, and I serve as a product line manager and then head of regulatory affairs at SafelyYou. And if you have not heard of us at SafelyYou, we are an ambient AI care platform with 3 unique solutions designed around resident safety, resident wellness, and then staffing efficiencies. And so we've been in the market for about 10 years, and really our mission is grounded in creating a world in which caring for seniors is worry-free for everyone, everywhere. So I'm sure as all of you are here in the audience thinking about your residents and your staff back at your communities, there's that worry. And so we're big believers in that if we can implement technology that allows our teams to do what they do best, which is being with residents, being with their families, being care providers, we can take the burden of some of that other administrative tasks and duties off of them. So that's who we are, and excited to talk to you all today.
Next, let's let Niels go.
Good morning, everyone. My name is Niels Coch. I'm the VP of Global Sales for Nobi. Nobi is a AI-based monitoring platform. We use both vision and sound AI to monitor residents, caregivers, and your community, essentially. It's a combination of fall detection, fall prevention. It's a lifestyle monitoring comes involved. We do care tracking, and we provide sleep insights, bedroom and bathroom behavior insights, and care tracking insights. So what are your caregivers up to? How often are they engaged with your residents in your community? For us, the technology itself, when we designed it in 2018, when we launched the organization, and today still, we have 3 big values that we hold dear: dignity, privacy, and desirability. When we designed the platform, we decided to tuck all this technology away in a hardware component that isn't very conspicuous and doesn't stick out like a sore thumb in the community. So we actually designed a ceiling mount light fixture that all of our technology resides in, and that can be deployed and seamlessly fit within any type of environment, whether we install in your residents' rooms, their bathrooms, or we go outside the units and install in communal areas.
Valerie?
Hi everyone, good morning. My name is Valerie Whitman. I'm the president and CEO of EyeWatch Live. We are a live virtual nurse monitoring service, so we use artificial intelligence and human intelligence. So really our goal is to get ahead of the incident, whether that be a fall or potential wander risk, as well as resident to resident, altercations that can occur. And so really our goal is, again, not only to make sure that the incident never occurs, of course you can never guarantee that to be the case, but that's really our goal, is to avoid that so that you don't have the domino effect of the person going out to the ER and your shorter length of stay. And then also having the data points around care minutes and care management and hourly checks and all of the things that technology can bring to your communities. I've been in this space for over 20 years in senior living. I've been in ED, I've been a regional director, so I get the pain points and happy to be here with you folks today.
Thank you, Valerie. And again, I'm Shelley Esden. I'm actually the COO of Nobi. And interestingly, I've only been with Nobi for 1 month. Prior to that, I was an operator for over 25 years. So I'm really excited to be on the technology side, and I'm very excited to be moderating such an esteemed panel. Thank you all for being here today. Let's get started. So first I want to take a few moments just to talk a little bit about how video has really permeated society as a whole. As I was mentioning earlier, we are now seeing it in senior living, but if you think about it, everywhere you go, no matter where you are, unless you're in a private room, you run the risk of being on video. Whether you're in your car, whether you're walking down the street, or whether you're actually at a concert, there's a good chance that you're going to be on video. So we now have them on our doorbells, we have them, the blink cameras, they're in hallways, they're in every retail store you can imagine. Car dash cams, they're on individual security folks, they're on police, and even home surveillance. And now we're seeing them in our resident rooms. And what does that mean? Additionally, I'm sure you've seen this slide about 1 million times, we are at a time where we are seeing the highest growth that we have ever seen in our senior population, projected to reach 80.8 million by 2040. I'm sure this isn't going to surprise anyone, but I'd like to highlight some of the factors that's going to weigh into the expectation for these 81 basic million folks as they start utilizing our aging services. We've seen a few shifts in our industry and our readiness for technologies, and I want to talk a little bit about some best practices for introducing and scaling new technologies. But first, I want to kick things off by asking, I think we'll start with Niels. What major shifts have you seen in the past 3 to 5 years that have made senior living communities more open to adopting new technologies?
Sure. Thank you, Shelley. Well, quite a few. Obviously, as we all know, the last couple of years have really made us, I guess, rethink the way we see and handle in senior living, especially with, as I'm sure you are all aware, with the pandemic. A lot of communities, a lot of operators found themselves kind of having to be on their toes and rethink things pretty quickly. It went from, and then specifically when we talk about video technology, from having caregivers in every room every day to having to rely on video confirmations, video calls with their residents. They had to rely on remote monitoring. They had to rely on dashboards to be able to even stay afloat. And I think what's really great, what has been really great there was that it really showed that innovation, whether you're talking about video or any other technology, doesn't have to be slow and impersonal. It actually can be done quickly, right? When a lot of these operators and communities found themselves in that situation, they moved fast because they had to move fast. And they were applying and implementing technology, and it wasn't always happening flawlessly, but it was happening with clear intent and clear focus. And I think that's key. What that also showed us, unfortunately, was a confirmation of things that we already knew, and that is that we're not dealing with short-term staff shortage. We're not dealing with just a quick bump in acuity. No, these are going to be the new baselines that we have to work with. So it's clear that we're dealing with long-term and higher needs on the care side of things for residents. We're dealing with staff shortages that are going to last for quite a bit of time, and that quite simply just thins out or thinly spreads the workforce that's available. In other words, burnouts are actually no longer just a red flag, they're reality. And I think with that reality, technology can play a major part. It just makes for technology being a necessity rather than just a tool that is out there for people to test. And I think from the emotional perspective, that's the biggest pivot that we've seen, that's the biggest change that we've seen, is that the perception of technology has changed quite a bit in those last couple of years since COVID. We see owner-operators respond directly. They're more proactive. They're seeing technology as the tool that is going to lead to a solution and as the means to actually scale caring responsibly. It is giving the means to a caregiver to focus on people, not on paperwork. It is giving you real insights to act as opposed to just gut feeling. So you got dashboards that give you real-time data about what's going on. And that's coming all out of technology that companies like ours can provide. But that perception, that mindset has really changed. People are thinking more long-term as well. So rather than just looking for a change and a quick change or a quick improvement to operations, or whether it's the well-being of the residents, the thought process for a lot of owner-operators has moved from that to, hey, let's take this technology that we discovered over the last 5-6 years, and let's now see how we can apply it long-term. But I don't think that, even though there's a lot of openness, there's a lot of willingness, that doesn't always equal readiness to apply those changes.
Thank you, Niels. Speaking of readiness, we have a lot of barriers that have prevented us for fully optimizing some of the technology that is so readily available. So, Valerie, do you want to share a little bit about that?
Sure, thanks, Shelley. So I'll throw a few things out there, and certainly anyone in the audience, if you have others, please feel free to share. Ease of use, right? I mean, technology has to be easy for your care staff to use. It has to be something that they're able to adopt easily and understand easily. That has been a barrier in the past. And I think a lot of tech partners like us have heard that feedback, and we've done everything we can to really minimize that and make it easier for the communities. So I encourage you to make sure that, as you are considering technologies, to provide that feedback to those different partners. Another one is competing priorities, right? I mean, any of you that work, regardless of your role in the community or regional or home office, there's constantly a priority and a fire that you've got to put out, sometimes literally, right? So that is something that you have to consider. Is there's never going to be the perfect time to do it, but it's one of those things that you have to be able to do. And another obstacle has also been, how is it going to impact my budget? Am I going to receive the intended ROI that I'd like to achieve? And that's really important to consider as well. And then I think one of the other things with technology, whether it's got a hardwire component like our services do in terms of devices that need to be installed, or if it's all software based, it's still an implementation, right? So there's the challenge of the disruption during that implementation process. So those are a few of the barriers that I think you've all faced from a community standpoint. And if, again, anyone in the audience has any others to share, we're happy to hear.
Thank you, Valerie. Natalie?
Sure, yeah. I would echo everything that Valerie said, that when you're in a community, there's this kind of element of constantly firefighting, right? So then when you're implementing something new, that's always going to be a challenge. And first and foremost, right, we're there to take care of the residents. But what does that investment look like in our time and our mental capacity to be able to take on a technology that's actually going to maybe make that firefighting a little bit easier in the months to come? I think another thing to call out too is just kind of tying this all back to why we're here is, this is an industry where, I think we're all friends in the industry, right? That we've been a little slow to adopt technology, and there's been a way of doing things for a long time. So now when we have companies like SafelyYou and EyeWatch and Nobi, how do we actually vet these vendors? What are the things that we want to ask? What are the outcomes that we want to see? So I think by you all being here is a great first step in understanding, all right, well, I do want to engage with a tech vendor, But how do I do that? So that's a barrier that we've seen, is a lot of times we do really need to partner alongside of our the organizations that that partner with us, so we can walk them through the process. To Valerie's point, it might be a software component, but it also might be a hardware component. And then what does the training and the implementation look like in terms of your staff and who's leading all of that? So those are things to consider, but I would say that is probably one of the other larger barriers, is just bringing the industry along to know how to vet vendors like us.
Thank you, Natalie. So as we are scaling and rolling out some of these technologies, it's important to obtain the best practices, and I don't think there's anyone better to share some of those best practices that we've seen than our panel here. So what recommendations or guidance do you want to give to the folks here that they can give to their potential partners as they evaluate different vendors that they're considering for technology initiatives? So, Valerie?
I thought you still had the mic in your hand, sorry. So things like framework and key success metrics, right? So you want to go into this, make sure you have a framework, make sure that you know what you're looking to achieve, what problem are you solving. And as Natalie said, having different options. If you have a few communities, put, one technology in one community, another in another community, run it for, 60, 90 days, whatever you feel you need from a time frame standpoint. But go into it knowing that these are the success metrics you want to have as a takeaway. And so when you set up that framework and you have the feedback from your staff, you have a champion that is going to basically provide that summary support to the partner that you're working with. It's things like asking yourself the simplicity, the affordability. Is it being adopted by the staff? And what can you improve? And do it in real time. Don't wait till the end of a 60 or 90-day pilot, right? You want to have it truly be a partnership so that you're talking with the tech partner and making sure that they understand what is working well, what isn't working well. And then also from success metrics, make sure that you're looking at the data. Again, with technology, the nice thing is we all have a lot of different data points that we can share with you. So take your baseline falls, your baseline, intrusions from resident to resident, your, potential elopements, and then at the end of the pilot, compare them, right? Make sure you're seeing a decrease in falls, a decrease in hospitalizations, an increase in length of resident stay, as well as considering your caregivers, right? I mean, the most recent survey I saw, it was earlier this year from Deloitte, it was looking at Gen Z and millennial caregivers, and 77% of them said we have an expectation that our company is going to have technology that allows us to improve our job and just be able to maintain the day-to-day. And we know that frontline care staff, they've got a tough job, right? And there's a real caregiver burnout and retention challenge. And as Niels said, there's also the shortage, right? So there is that expectation that you're going to have technology in place and you want to remain competitive to make sure that you can retain your staff. And then also, again, from a budget standpoint, did it increase your profitability? Did you have increased satisfaction with your residents and families? Video technology can be very powerful, and we've seen that where we're able to monitor that resident live when they start getting up and they need to be assisted. Maybe they're a high fall risk resident, and at that point, we're able to communicate directly to the on-site care staff. They get right down to the room, and I'll tell you, initially we thought that the care staff would see videos and cameras in the room as a big brother, like somebody's watching me and they're trying to get me in trouble. And we've seen the opposite. People feel like that's a second set of eyes for them, that we're directing them exactly where they need to go versus them having to open every door, doing their hourly checks throughout the night to make sure that the resident is safe and hasn't fallen. And so it's actually improved their efficiency, and they've come to expect it. We've actually had a few people move from one company to another and say, you got to bring EyeWatch because it makes my job easier. So whether it's SafelyYou, Nobi, EyeWatch, or any of the others that are out there, you want to get the feedback from your staff and make sure that it's improving their workflow, not actually making it harder. So those are some of the success metrics, but definitely focus on the data points, particularly around the budget piece, because we all know NOI is a challenge and technology can be expensive, but if you can partner with Companies that are able to get diversified payer sources, like your liability carriers, in many cases are willing to pay for some of the cost of our technologies because it lowers the cost on their out-of-pocket claims. Yes?
Do you know of any insurance carrier in Florida that is paying for technology?
Yes, so there are some carriers and brokers, and I'll answer that in two parts. One is some of the health insurance carriers. So, for example, EyeWatch Live, we have Medicare Part B, and so no different than a physical therapist coming in, providing services to your residents, and then billing their insurance. United Healthcare, Aetna, there's Curana, a lot of these groups that are looking at value-based care to reduce the cost on the healthcare system. And then from a liability standpoint, Marsh is one of the brokers that is lowering the cost for their operators because they're seeing that the technology is decreasing their fall claims, which today are an average of $267,000 for one fall claim. And that's what your insurance is paying. And of course, many of you have deductibles that range from $50,000 to $100,000 per incident that hit your operating budget. So it definitely, from a technology standpoint, there's a huge opportunity to decrease your cost, but also diversify the payer source so that it's not either falling to you as the operator or to the family.
Thank you, Valerie. As we're looking at our operators' compressed margins and we're looking at the cost of these technologies, it's interesting. I think most operators are dealing with the challenge of adoption. I know that historically when I was operating communities and I would take on new acquisitions, it would always be interesting to go in and to find multiple platforms, multiple technologies, but no one was using them. And then with additional costs impacting our bottom line, it's really critical that we evaluate ways to ensure successful adoption, especially with those technologies that are going to deliver on the ROI side. So, Niels, do you want to talk a little bit about some best practices related to this adoption?
Sure, absolutely. And I think we've all seen it, right? Shelley described it, but I think everybody in one way, shape, or form has experienced it. You invest in and roll out a beautiful technology, and then pilot fails. And it's not because the technology isn't doing what it's supposed to do. It's just because that adoption isn't there. So I think there's two key points. Valerie just mentioned, having all the different people within communities that are using our technologies absolutely love it. I think it's of the utmost importance that those people, all the different key stakeholders, whether we talk about management of an operator or management of a community, or even the caregivers, the nurses, everybody on the floor, they're all stakeholders in one way, shape, or form. And I think it's of the absolute utmost importance that right from the get-go, once there's a decision to go into a partnership with a vendor such as ours or such as us, that we, from our side, have the responsibility and the commitment from our end to make sure that that adoption is being done. And that's leaning on two different pieces. It's leaning on involvement and leaning on communication. And that is not just an immediate short-term thing, that's a long-term part. That's part of that long-term relationship that we're looking to build with our users as well. So I think it's very important for everyone in the room, on our side as well as on the operator sides, to make sure that we identify, and we can do that jointly, that we identify those stakeholders and that we make sure that we involve them in the conversation right from the get-go. As soon as we get into the communities, as soon as our technologies are implemented, the main stakeholders are the main users. That's your residents, that is your care staff, it is your management in that community. All of them in one way, shape, or form need to be involved in that conversation. Your residents specifically, right? We're putting technology in their living spaces. A lot of that technology has optical sensors or cameras, is watching them. They need to have a proper understanding of what it is that's hanging over their head. We have those conversations with family members. We have those conversations with your residents, with your care staff, to Natalie's and to Valerie's point as well. Sorry, yes?
So just a question, so how do you guys deal with when you get an attorney, a law firm plaintiff's attorney sending you a subpoena to your company demanding the metadata for an event that happened, say, at my facility? And if I have your technology here, what do you do?
Yep.
When you get the subpoena? You're going to get a subpoena. They're going to demand that you produce the metadata for whatever time period, and they're going to demand that you provide that metadata within time served. So what do you do? What's Nobi do?
So on Nobi's end, there's a few things that happened way before all of that. I was talking about having conversations with family members and having conversations with the residents as well. Within implementation stage, we actually have several town halls in which we invite everybody to attend, and that's the people that work on the staff side of the community, but also the residents living there and their family members that are often very closely involved. During those conversations, we have proper information that we share with them regarding what the technology is, how exactly it works, and without getting too deep into the weeds, we actually give them full insight. Yep.
Incident. If you had an incident, your POA has now decided to sue, you're going to get a subpoena.
Mm-hmm.
What I want to know is what does Nobi do once you get the subpoena?
From our perspective, our agreements with our customers and with our users is such that obviously the data is made available to them. Whether or not there are recordings is entirely dependent, and that's what I was kind of leading on with the conversations that we have with the family members, is dependent on what level of privacy settings we've determined within the system. So there may have been an incident that we notified the staff of, but that incident may have just been a notification that staff received because family member and or resident right from the get-go made the determination if there is something that AI detects that's going on in my room, let it be a fall for this situation, for instance. We don't record that fall. We just notify the staff there's been a fall in room X, Y, or Z. That's privacy setting number one. The opposite end of that is full transparency. You have the real resident in the real environment. There's an incident that had taken place. The resident has fallen. There is the possibility of having an actual video recording of that. That's the flip side of the medallion, and that's full transparency. That's another privacy setting that right from the get-go, resident and family member had chosen for. Down the middle is the third alternative, and that's where we see most of our users actually lean towards, and that's where we actually have the ability to, in real time, replace the resident from the equation, read footage, and replace them with a color-coded stick figure. So you have that level of privacy where there's never a real image of a real person leaving our hardware, never being seen by a human eye unless it's intended to. These three flavors can be sent out in one way, shape, or form, and that's the information that you as an owner-operator would have available, again, depending on what privacy setting has been determined. That data does never get shared by Nobi with anybody other than our customer. It is the community at that point in time that determines what the actionable item is when a litigation or whatever scenario plays out.
You get a subpoena, you can't tell the court, well, I'm not compliant.
I'm sorry?
You can't tell the court, I'm not compliant. I live over.
From our perspective, the data's gone. So we don't store images for longer than 2 weeks. They become owned by the communities and or the residents, depending on what the privacy settings would be. But from our perspective, it is gone. So the only thing we would be able to give whatever attorney reaches out is a color-coded stick figure in a white space, and that's really it. Yeah.
Thank you, Niels.
I did, if you don't mind,
sorry,
though,
please.
however, I wanted to continue the chain of thought that I started on. It was a great question, by the way. But I do want to make sure that, and I think this is something that both of my panelists and some of the other technology vendors that I see in front of me here as well can attest to as well. It is of the utmost importance that relationships that you build with your vendors are seen as such as well, right? We have a good reason to justify the fact that you've invested in our technology, and we want to make sure that this partnership is seen as a long-term partnership as well. So from our perspective, it is a requirement that we make sure that those people that can build those relationships, cater to them, and consistently maintain them as well, because community change, residents change, technology changes within the partnership that we're building, within the tenure of whatever the length that may be. We want to make sure that you benefit the utmost from our solutions, and that is by proper adoption, but also by proper modification and customization throughout the length of that partnership.
Thank you, Niels. Natalie, let's talk a little bit about the scalability and roadmap of technology for the future.
Sure. So, I think one of the things that's very important, my other panelists have said, is you want to make sure that you're partnered with the right company, that you're getting the outcomes that you want, and then you go through your pilot, and perhaps it just goes really well, it's fantastic. But then what does that mean in terms of scalability for the rest of your organization? So I think those are a lot of questions that you'd probably want to ask up front too, is what does this look like if we are successful in 2 buildings? Can we scale and get the same level of service at 50 buildings that we do at 2? And it really comes down right to that implementation process where technology on its own is great, but you have to make sure that there are people in the buildings, also at the home office that are supportive of it, so it doesn't just become this technology graveyard, right, in a couple years. You need to make sure it's answering a problem for your organization, you're getting the outcomes that you want to see, and that you can really see it across your entire portfolio or however far that you want to implement that. And so I know one of the things for us at SafelyYou is it's really developing that relationship, and Niels and Valerie were talking about that as well, where we see ourselves as community care consultant. So we have a branch of our business that are all clinicians. So we call them our clinical success managers. So they're there to make sure that that technology is adopted on a regular basis. So once we've established what those workflows look like for your organization, then there's someone on our team that's connecting regularly and really coming alongside your care teams to make sure that in those days, right, where they're firefighting and maybe literally putting out fires or figurative fires, that technology is still really at the forefront if it is truly solving the problems that you want it to for your organization. So kind of to bring it all together, I think once you have that great pilot, you found the vendor for you, your ethos of your companies align, then ask those questions. What does this look like 2 years from now? What does this look like with 20 extra buildings to make sure that those benefits that you get at one building can really be across your entire organization?
Thank you. So we've chosen a partner. You've ensured that it's going to be an ROI to your bottom line. There's going to be a return on your investment. You've also looked at their implementation process. You feel very, very sure that you've got a partner that's going to ensure adoption. You've got the education, the tools to account for the workforce issues and with turnover and everything else that we experience every day. Now it's time to look at the outcomes. So what do you do with this information? Most technology firms are building a platform or providing data and generating results. How do you ensure that? So let's look at some of the real world outcomes and look at how video technology has improved the care and profitability in some measurable ways. And first I'd like each panelist to speak on this, and Valerie, would you kick things off?
Sure, thanks, Shelley. So again, some of those outcomes that you want to be able to achieve, if you think about it in a few different buckets, of course you want to think about the technology and how it's supporting your caregivers. So again, do you have better retention with your caregivers? Are they happy? Are they sharing with you that this technology is improving their job and of course the quality of life for the senior, which is why we come to work every day and why we're in this industry, right? And then also, are you seeing an increased retention with your caregivers? And then on the flip side with residents, are you also seeing, again, you should see an increased length of stay with these types of technologies? Are you feeling that the communication with the family is better? And video technology can show that, and we've had many instances where a family may have thought, they came in to visit their loved one and it looked like they had fallen and they had a bruise. And the care staff said, we didn't see a fall. If you don't have the technology that's available out there today, you can't prove to a family when sometimes the family might say, well, I don't think they fell because my loved one doesn't have a problem with falling. And they think maybe there was something going on from an abuse or a neglect standpoint. And we've been able to, have that customer, that operator, that ED show the family in many cases that here's what's happening with your loved one overnight behind that closed apartment door, and they just don't know. So you really want to make sure that the outcome is truly, as Natalie was just saying, a tool that you're using day to day. It should be something that you have access to through a portal or an app that you can see in real time what those success metrics look like from a data standpoint. And then also from a profitability standpoint, right? We want to make sure that, again, this is something that at the very least is budget neutral for you, but really is an opportunity where these technologies and as we see in the future more and more coming out, that health insurance carriers and liability carriers, people, as Niels said, all stakeholders, right? We're all looking to reduce the cost on healthcare. We're all looking to be able to diversify payment sources so that it doesn't all fall to the family or the resident who's already paying a significant amount to live in our communities, right? And they only have so many dollars to go. So we want them to be able to live there as long as possible. You never want people to have to move out for financial reasons. So anything that you can do to help, get the technology in your building, but also be able to have someone else pay for it, ideally, or have it pay for itself, right? And those are some of the outcomes that you want to be able to achieve.
Excellent. Natalie, how do you and your team measure success with your new senior living partners?
Yeah. So, what's really important to us, I'll go back to that relationship piece. So we really want to come alongside our customers and understand what is the most important thing for your organization, right? So as Valerie called out, right, there's financial outcomes, there's also clinical care outcomes, there's resident and staff family satisfaction as well. So we want to understand, first and foremost, what is the most important thing? What's the charter for your organization? And then we'll be very honest and transparent about what we feel we can achieve together. And so the way that we do that is during the initial pilots, we'll set those goals. And then during a pilot, we'll make sure we have a mid-pilot review to ensure that everything is running to track, right? So these are still the goals. This is how it's going. We might need a little support in this area. Or, hey, your team's doing fantastic. Thank you for supporting them as we've implemented this technology. And then we follow that up with a full pilot review. So then, all right, at the end of this 90 days, did we meet the goals? And then if so, all right, what does that look like now for the rest of your organization and that scalability piece that I was talking about? But the other really important thing is that it doesn't just end at 90 days. So because there's that relationship factor, we want to have a regular schedule where we're constantly checking in, that we don't wave the victory flag right at the end of that pilot, because this is real life for our residents. This is real life for all of you in the room. And if you're adopting a technology, we want to make sure that you are getting the outcomes year after year that you partner with us. So essentially, it just comes down to those regular connections. So as I mentioned, we have a clinical arm of our team where they're actually meeting with on-site care teams on a regular basis, maybe ranging from every week in the beginning to bi-monthly and then monthly. And then from an account management standpoint, we do quarterly business reviews. So we're constantly tracking to those original goals. And hey, maybe things have changed. There's maybe some waters that are shaky in certain ways of the business, and we might have to readjust those goals. So it's all about staying transparent, building that relationship, and having those regular touch points to make sure we're tracking to goals.
Thanks, Natalie. Niels, what are some ways you've nurtured the vendor-operator relationship, to keep the improvements coming?
I'll answer that question in a second. I think I want to add a little bit to what Natalie and Valerie have mentioned as well. I think one thing as well that I'm hoping that we're all, cherishing very highly too is the emotional impact, right? We're talking about NOI, and I think emotional impact kind of trickles down to that eventually as well. But the impact that we have on your care staff, and even more importantly, your residents. Once you bring technology like this into your spaces, as I mentioned earlier, you get insights in your resident behaviors, you get insight in your caregiver behaviors, get insight in what's going on inside your community as a whole with the technology being rolled out across the board. That's all great. NOI and ROI will definitely follow. But the bigger part in the mission that I think we're all chasing is the impact that we have on your residents. Once we have the ability to have that conversation with your residents about the technology and what it can do for them, they're going to get a sense of safety. And that is something that trickles down in any direction within your organizations, whether you're a community owner or an operator that has several of these communities across the country. A resident that knows, hey, I'm being monitored, I'm being supported, I'm being helped, and whenever something is going to happen, there is an AI tool in my room that will notify the right person that will be able to respond. They're going to live a happier life. They're going to sleep better. They're going to feel more relaxed than if they didn't have that didn't have that feeling. And I think that's a crucial piece of impact and success for any of us as well. And I think on the other side, on the operator side, same thing. If you know, hey, our residents are living a happy, healthy, and safe life in my communities, that has impact on all levels of that community and all levels of that operation. So I think that's an important piece not to forget. I concur with everything my colleagues here mentioned. And also firmly convinced of the fact that if you have happy residents, you have satisfied caregivers in your community, everything else will follow.
Thank you. Do you want to weigh in a little bit on how you've nurtured the relationship as the operator and partner to...
Yeah, sorry, absolutely. I rambled on there for a second. No, I think that goes back to the answer I had to the previous question as well. I think it's just, from both perspectives, from both sides of the coin, we need to see this as a long-term partnership, and the best way to do that is same as any type of relationship, right? Continuous, clear communication and making sure that there is someone to rely on the other end. So key identification of the people that we need to be able to work with on both ends. That's both on the vendor side as well as on the operator side. We need to know, hey, I've got something on in one of my communities, or we've implemented product X, Y, or Z, and I now need assistance. Depending on what that might be, the first thing you ask yourself, who do I call? And I think that's part of our implementation, that's part of our training, and that's part of our continuous collaboration with our customers, is making sure that those key people are always linked together and are in constant communication, or however constant you need that communication to be. I think that's critical to any success in any type of relationship.
So, thank you,
Make sure
Niels.
my wife hears this as well, by the way. Yeah.
Right, so here's some of the benefits and outcomes that the panel has discussed, and these are just a few of the things that, as an operator, you should be looking to your video provider, your tech providers, for some of these results. Before we run out of time, though, I do want to open up for questions. And does anyone have any questions for any of the panelists?
Great question. So just to make sure everyone heard, do we have the ability to have those of you using EHRs or EMRs provide data over to us and vice versa? And I can speak for EyeWatch Live, where we do have, and it comes down to the customer, whatever the owner-operator group is looking for. Today, we can do bilateral integration where your information is pushing to us, meaning that we can get the information on the resident, their diagnoses, their health insurance information, and then that way we're billing insurance. We can also do, and that would be a one-way integration, we can do a two-way integration where then our data is going back to your EHR and, to your point, becoming part of the resident's medical record. So you have the option to have a dual or single integration, and it really comes down to you as the operator. And to your point about someone comes in from the state or from a liability standpoint and they want to see what's in the medical record. You may not want the information, the video that you can either do live or be recorded, or recorded for X amount of time. There's some states that require a certain amount of time. Many states do not. So it really is up to the operator and what you're comfortable with and what your general counsel and insurance and all of that have recommended. But I do think that with technology, and we've even seen, point-click care, for example, I can remember using that 15, 20 years ago. And they all have what's called open APIs now, right? So they can easily integrate to companies like ours, because it is important to be able to make it easy for your care staff or whoever might want to see the information, be able to see all of the information versus having to go into different systems, right? But again, that's up to the operator, but that's how we manage it at EyeWatch.
Thank you, Valerie. Natalie, do you want to add anything, or Niels?
Yeah, I mean, I'll just echo what Valerie said too, but yeah, there's the one-way integration or dual integration, and so it's definitely something that we have on our roadmap and where we are integrating with some of the top EHRs right now, but I think it does come down to Valerie's point of what are those particular things? Like, what is the no-fly zone in terms of information that you want flowing back into your EHR? So definitely something that if you find a vendor, ask those questions and make sure that that is customizable for your risk tolerance.
And I think there's a bigger picture there as well, right? We talk about EMR on one side, but at the end of the day, you run and operate communities. EMRs and our types of technologies are but a few of the factors that are in play, right? You'll have 6 to 7 to maybe a dozen different platforms that you've got up and running that all do interesting things, but they're all in one way, shape, or form related, yet still different. I think it's key that there is a form of integration between anything and everything you have up and running, whether it is your EMR, whether it is your resident engagement platform, you've got access control, you've got platforms that are doing visitations and those types of things. So I think it's of the utmost importance that when you make selections within your technology stack, that those things are taken into account as well. How well are those different things going to be able to talk to each other? And how am I going to be able to rely on data that's been collecting from all the platforms gathered somewhere and then gives you a true 360 visual of what's going on within your communities. And that's not necessarily all provided by a single provider, but those are technology stacks that you put in your buildings that then need to be able to communicate with each other. So I think integration is a part of running any successful operation again. And yeah, there's something I will talk with my wife about too.
Thank you, Niels. One more question. Yes. So
Yeah, great question. And I know insurance is a hot topic for everyone, right? Because premiums continue to go up. And of course, any types of incidents, you're paying a deductible every time. And it's a huge hit on your budget, right? And so, yes, to answer your question, we have, again, I want to speak for EyeWatch Live. We have some different agreements with different carriers, different brokers. We've actually had some of our clients come to us and say, we're getting nailed on the insurance and with the deductibles. And we have one client that has 17 open fall claims across about 400 units. And their deductible per building, per claim is $100,000. It's a massive challenge, right? So we are able to let those clients know about some of those different insurance carriers and brokers that have, formed an agreement with us that they'll pay a certain amount to us directly. They can't pay it directly to the community because that's illegal for them to do, but they can lower their cost. And so that is one of the diversified payer sources that we look at so that it's a lower cost or really no out-of-pocket cost to the operator. So to answer your question, yes, we have seen that. Again, I don't want to speak for my colleagues, but I do think that insurance companies are starting to recognize that these technologies are benefiting them as well, and they want to share in the savings. No different than value-based care wants to reduce the cost, and then everybody, all the stakeholders, share in the savings.
Thank you, Valerie. Anyone else want to weigh in?
So one other comment, related to, some maybe insurance premiums going down is also talking to your capital partner where they might have some preferred discounts with vendors. So if we can bring these outcomes to a capital partner and they say, all right, well, if all of my buildings within this portfolio are using this technology that's ultimately producing the ROI that's expected, they're meeting their budget marks, their NOI, then yes, absolutely, we'll give preferred pricing or discount. So another a kind of outcomes-based discount that you could be looking for.
All right, thank you. At this time, I would like to thank our panelists. I think we're out of time today. And as we move forward, I think as demonstrated by our panelists here today, there's been a lot of evolution as it relates to video. But I also think that video is here to stay. And if you look at these outcomes are measurable. They've been verified. When you're looking at the resident safety and well-being being impacted. We're starting to see benefits not only to the bottom line, but to the relationship, to the productivity of staff. So I encourage you to learn more, evaluate your partners, and establish a true partnership. And if anyone has any questions for any of the panelists here, please stay after for a few minutes. We'll be around for another 10 or 15 minutes to answer any questions you may have. Have a wonderful day.